Welcome, everyone. This is Talking Ketamine, episode 22. Today, we're really zooming in on one specific story, a case study that gives us a fascinating look into ketamine therapy's potential.
Exactly. We're looking at a report by Elizabeth Francis and her colleagues, published in Curious, and it's all about sublingual ketamine, under the tongue. It's a really powerful account.
Right. So, our aim today is to sort of unpack this patient's story, understand what they went through, and, see what lessons it might hold about ketamine, especially for folks with those really stubborn, treatment-resistant symptoms.
Think of it like focusing a lens, getting a really detailed view of one person's journey towards, hopefully, recovery. The insights might actually reach much further.
Okay, so let's start with the person at the center of this. Who are we talking about?
We're talking about a 37-year-old man. He was a sales trainer, actually, working at a Fortune 500 company. He showed up at a psychiatric clinic back in January 2025, and he was carrying, well, a lot.
A heavy burden, sounds like. What specifically was he dealing with?
Yeah, quite heavy. He had long-standing diagnoses: major depressive disorder, PTSD, social anxiety. And the symptoms he reported were pretty significant things, like constant low mood, feeling emotionally numb, intrusive memories popping up,
Uh-huh.
pulling back socially, trouble concentrating, sleep all over the place, and, just not getting pleasure out of things he used to enjoy. What really stood out, though, was him reporting passive suicidal thoughts several times a week.
Wow. And this wasn't something new.
No, not at all. There was a family history of anxiety and depression, and he himself had already run through, well, a whole series of traditional treatments.
Right, the usual suspects. Can you give us a sense of what he'd tried before turning to ketamine?
Oh, definitely. He'd been on multiple medications over the years, things like sertraline, venlafaxine, bupropion, even Adderall at one point.
Okay.
And the story was always the same, really. Either they only helped a little bit, or the side effects were just too bad and he had to stop, or sometimes they just did nothing much for his mood or how he was functioning day to day.
So despite all that effort,
Exactly. Despite trying all these different avenues, he was still stuck with moderate to severe depression and anxiety. He clearly met the criteria for treatment-resistant depression, TRD.
and TRD is such a difficult place to be, isn't it, when the standard playbook just isn't working. What was his baseline like, symptom-wise, before this ketamine trial started?
Yeah, it's incredibly frustrating for patients. His baseline scores really paint a picture. His PHQ-9, the patient health questionnaire, was 23. That's severe depression territory.
23, yeah.
His GAD-7 for anxiety, 19, also severe anxiety. And the MADRS, another depression scale, was 33, moderate to severe.
So these aren't just numbers on a page. This was really impacting his life.
Profoundly. It meant he couldn't concentrate well at his job. He was avoiding social events because of the anxiety, the fear. Even basic things like personal hygiene were becoming difficult.
Yeah.
It really shows the depth of his struggle, which, lines up with things we've talked about before, how severe depression just permeates everything.
Absolutely. So, okay, all these standard treatments fail him. Then they decide to try sublingual ketamine. For anyone listening who hasn't heard of that specific method, what does sublingual actually involve?
Right. So sublingual just means the medication is placed under the tongue to dissolve and get absorbed there.
Okay.
And it's getting a lot more attention lately because, well, think about the standard 5E infusion. That needs a clinic, medical staff, monitoring, and there could be issues like infections at the IV site or painful vein inflammation, phlebitis.
Yeah, that sounds complicated and maybe uncomfortable.
It can be. Sublingual delivery, though, is potentially much more practical. It's less invasive, potentially more accessible for patients. That accessibility piece is huge because getting to specialized clinics can be a real barrier.
So it could open doors for more people?
Potentially, yes.
Yeah.
It hints at maybe moving towards care that's a bit more routine, easier to access, especially for people who feel like they've run out of options.
Okay, so this patient starts the sublingual ketamine. He's been struggling for years. What happens after just 3 weeks on this treatment?
Well, the change was pretty dramatic. Quite remarkable, actually, and fast. After only 3 weeks, his symptom scores dropped significantly.
How significant are we talking?
We're talking the PHQ-9, which was 23 severe, plummeted down to 3. That's minimal or no depression.
Wow, from 23 to 3.
Exactly. His GAD-7 anxiety score went from 19 severe down to 2. Again, minimal or no anxiety. And the MEDR score dropped from 33 down to 5. Minimal symptoms there, too.
That's incredibly fast.
It really is. That rapid response is, one of the things that makes ketamine so different. Traditional antidepressants often take weeks, sometimes months to show any real effect. If they do, this was 3 weeks.
Those numbers are just astonishing. But what about him, like his own experience? Did he feel that different? Numbers are one thing, but
Oh, absolutely. Subjectively, he reported huge improvements. His sleep normalized. He started actually going out and doing social things again, things he'd avoided for ages.
that's great.
That feeling of being constantly on edge, the hypervigilance, that reduced significantly. And crucially, those passive suicidal thoughts he was having several times a week, completely gone.
Completely gone.
Yes, complete resolution. And you can see it in his check-ins, his mental status exams. Over the treatment course, his whole presentation changed. He'd been kind of flat, anxious, that shifted to being much more, well, normal. Balanced euthymic is the term. His attention span improved. It really shows how powerful ketamine can be at quickly knocking down those severe symptoms.
It sounds like it just changed everything for him.
It really seems like it did. And along with those core symptom improvements, he also reported having more energy, thinking more clearly, just functioning better day to day.
Mm-hmm.
So ultimately, what he described was a really significant improvement in his overall quality of life as the treatment went on, which underscores, that good treatment isn't just about making the numbers go down.
Right. It's about getting your life back.
Exactly. Restoring that ability to actually live a full, engaged life.
This case is such a powerful illustration of ketamine's potential, especially, like you said, for people stuck in that treatment-resistant cycle. When you look at this one story, what are the big picture implications that jump out at you?
Well, what's really interesting is how this single case seems to reinforce a couple of key things we've touched on before. One is about the duration of effect. We've often discussed how ketamine's antidepressant effects can sometimes be pretty short-lived, right? Days, maybe a couple of weeks. That's been a challenge for using it long-term.
Yeah, the maintenance question.
Right. But here, this patient showed significant, sustained improvement after 3 weeks of this sublingual treatment protocol. That suggests that maybe this kind of repeated dosing using the sublingual route could actually be a viable way to maintain relief long-term for TRD. That's a potentially very big deal.
Finding a sustainable approach would be huge. And the other thing you mentioned was the suicidal ideation. The speed at which that resolves seems critical.
Absolutely critical, especially when you consider the broader context. We know that sometimes, very rarely, with certain psychedelic therapies, those really intense mystical experiences can, for some individuals, temporarily increase suicidal thoughts.
Right, that's a known, though rare, risk.
It is. But this case really highlights ketamine's potential to do the opposite, to rapidly reduce those severe, life-threatening symptoms. In a clinical crisis situation, that speed is just invaluable. It really brings up important questions about intervening quickly and effectively to prevent the worst outcomes.
It's just, well, it's genuinely encouraging to see an example where a different approach, one tailored like this, can make such a profound difference so quickly for someone who seemed to have run out of road.
It really is. And this case study from Francis and colleagues, it gives us these really valuable clues. Clues about how we might take treatments like ketamine, which we know can be highly effective, and adapt them so they're not just stuck in these specialized, often expensive clinic settings.
It sort of opens up the possibility of these advanced treatments becoming maybe more integrated into regular care, making them more accessible.
That's the hope, I think. It paints that kind of picture. So maybe a final thought to leave you with. If just changing the delivery method, going from IV to sublingual, for instance, can unlock this kind of transformative potential for such severe, long-standing problems, well, what other maybe simple-seeming adaptations to treatments we already have might be out there, just waiting to revolutionize care for people who desperately need something new?
Definitely something to think about.